Hi, everybody. Thanks again for joining. My name is Darcy Delgado. I am one of the DSH staff members on the mental health diversion team. We are super excited to be hosting today's webinar entitled Funding and Sustainability Planning for California Counties, and we're extremely lucky to have Deanna Adams, who's going to be our presenter today. So I'm going to give a little bit of housekeeping information and introduce Deanna and then hand it over. So to begin, just to let everyone know, this webinar is being recorded, and so will later be available on our DSH Diversion website if there are individuals who weren't able to make it today. We ask that you hold any questions until the end for our presenter, and what you can do is go ahead and enter your questions into the chat feature in the bottom right-hand corner of the WebEx, where you'll have the opportunity to send those questions to myself, and you can go ahead and do that via the text feature throughout the presentation, but then I won't pose the questions to Deanna until the end of her talk. I do ask that everyone remain on mute. You are muted upon entry, but if you could just keep yourself on mute during the presentation, that would be great. So I'll go ahead and introduce Deanna. Deanna Adams is a project manager with the Council of State Government Justice Center. Deanna works with state and local policymakers to improve responses for people involved in the criminal justice system who have behavioral health needs. She previously served as a senior fellow with the CSG Justice Center and the Chief Probation Officers of California, and has worked with California counties interested in improving their criminal justice, health, and other reentry outcomes for people who have behavioral health needs. Before that, Deanna served as director of a community-based organization in Santa Cruz County that provides evidence-based interventions and reentry services to people in jail or under probation supervision. Deanna also previously engaged in private legal practice. And we're really lucky to have her because we know that questions of funding and how to sustain funding for your mental health diversion programs is a question that we're getting a lot of, we're just getting a lot of interest in this topic and discussing this. And so we hope that this is a helpful webinar for you. And Deanna, I'm going to hand it over.
Thank you, Darcy, and welcome everyone to today's webinar. The webinar is hosted in collaboration with the Department of State Hospitals, as well as with the Council on Criminal Justice and Behavioral Health, and of course, the Council of State Governments Justice Center. The Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials across all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. We develop research-driven strategies to increase public safety and strengthen communities. For today's webinar, I will walk through tools designed specifically to assist California counties in identifying, prioritizing, and pursuing funding opportunities available through federal, state, and local sources, followed by an overview of strategies that demonstrate how diverse counties are sustaining their diversion and reentry efforts. As Darcy mentioned, there will be time at the end of the webinar, so if you have any questions, please provide those at that time. Through a project funded by the California Healthcare Foundation, the Council of State Governments Justice Center, and the California Association of County Executives collaborated to develop a set of comprehensive tools designed to support counties in strategically leveraging federal, state, and local funding streams to reduce the prevalence of people who have mental illnesses and who become involved in the criminal justice system. These tools are titled Tools to Facilitate Integrated Funding Planning, and they comprise of 4 components that are all designed to meet counties where they are in the funding and sustainability planning process, as well as to speak to the needs of counties of all sizes and that have varying resources and resource needs. These tools are free to use, and they include the Key Considerations Guide, which is developed for county administrators or county executives, and also includes a repertoire of funding sources and other information that is useful to county behavioral health, criminal justice, and other agencies working to address the needs of people who have mental illnesses and who become involved in the criminal justice system. The tools also include a comprehensive index of common federal, state, and local funding sources that counties can use to finance strategies focused around this population, as well as worksheets that help guide counties through identifying and prioritizing local strategies, as well as funding streams that they can use to pay for them, and an interactive workbook to support county funding and sustainability planning processes and to assist counties in maximizing the reach of funding spent to pay for their efforts. These tools can be used and sequenced together as your county works through the funding and sustainability process, or they can be used as standalone tools depending on the needs of your county as you engage in the planning process and what you already have in place. These tools were informed by an advisory group of county leaders from across the state, from large counties like Los Angeles and Santa Clara to smaller counties like Trinity. The advisors also included key county stakeholders such as county executives, county supervisors, behavioral health directors, probation chiefs, sheriffs, health plans, county housing agencies, as well as state agencies overseeing key funding sources. I will now walk through each of the tools so you can consider how they may be helpful to you as you think through sustainability planning for your diversion programs. I'll also provide examples of how counties have used the tools and examples of creative approaches that counties have used within their funding and sustainability planning processes. So the first tool that we will cover are the key considerations for county executives. The Key Considerations Guide was developed to provide practical guidance for county executives who are looking to maximize the impact of local efforts. As county behavioral health, criminal justice, and other agencies are working collaboratively across systems to implement a number of programs and responses for people who have mental illnesses as they enter into and exit the criminal justice system. The key considerations are focused on how counties can effectively fund these efforts while efficiently maximizing the reach of available dollars. Based on interviews with county executives from across the state, this guide also discusses the role that county executives can play in informing how different strategies that are funded through public safety and health budget items fit together, as well as ensuring that the overall spending is achieving system-wide outcomes. This guide is available at the link on your screen. I know it's a bit long to remember, so if you are looking for an easier way to get to it, you can visit the CSG Justice Center website at csgjusticecenter.org. There's a search box at the top of the page. Just type in integrated funding, click search, and the guide will be one of your first, I think the first two search results. I know that there is a mix of people who may be listening in today beyond county executives, so there are parts of this guide that are applicable to you and to where you are. So I'll go through those in a moment. The main portion of the tool that I think you all would find very helpful is an appendix that outlines federal, state, and local funding sources that are used to pay for policies, processes, and programs that are often difficult for counties to fund. This index came out through a brainstorming session with the project's advisors who represented counties of diverse sizes and different types of resources. Through that brainstorming session, the advisors identified funding streams used to successfully carry out these difficult to fund strategies, which are encompassed in this appendix, and we suitably titled it, How Did They Pay for That? This appendix covers strategies classified under 6 categories, including jail and court-based treatment, IT infrastructure, housing, community-based treatment, workforce development, and client and community outreach and services. Included within each category are funding sources matched to specific county needs. I will not go through all of the subcategories listed on your screen, but we'll review a few of them that particularly sticks out because of how often they come up when we talk with counties about their funding needs. So these include jail-based mental health treatment, staff to provide jail in-reach, and case coordination to provide warm handoffs as people are being released from jail, IT systems and IT staff, housing units, and staff to coordinate the connections to and the retention of housing. Staff to facilitate the care coordination across criminal justice, behavioral health, and other county systems that address social determinants of health, case management with law enforcement, county staffing and training needs, and health treatment and services ranging across California's physical, behavioral, and public health systems. To put this index into context for you, this slide shows a snapshot of the funding sources identified to pay for housing subsidies. As you see, funding sources comprise a mix of federal, state, and local funding sources. We encourage you to take a look at the Key Considerations Guide generally, and Appendix A may be particularly useful as you think about what funding sources you may want to access to fund and sustain your diversion program. Again, you can find this guide at the link on your screen or by searching integrated funding in the search bar at the CSG Justice Center website located at csgjusticecenter.org. I will now talk about Common Funding Sources Index that we've developed, which complements and expands upon the funding sources identified in the Key Considerations Guide. The common funding sources to use to finance local strategies to reduce the number of people with mental illnesses in jails is a curated index of diverse funding streams and was developed to assist county leaders in effectively funding local efforts. It is meant to be a non-authoritative advisory resource to assist with the planning process and designed to complement your planning process regardless of where you are and, of course, regardless of the size of your county and your resource needs. The index comprises a non-exhaustive list of federal, state, and local funding sources that counties could leverage to pay for local diversion and reentry efforts. The index also includes helpful information about each funding source to better assist you in identifying which sources you may want to pursue. This slide illustrates the level of detail provided for each funding source. The information captured includes a summary of the funding period, how each funding source is commonly used, notable funding limitations, the key external resources and websites that you can visit to learn more about the funding opportunity. Where applicable, it outlines the key local advisors within your county who may already have knowledge about the funding source and who you may want to engage. Each funding source is also accompanied by icons to indicate, when applicable, additional information that may help you better identify which funding sources to pursue. These icons include indicators of whether your county would be required to provide matching funds or a local share in order to pursue those funds, whether the funding source can be used to draw down federal Medicaid dollars, and whether you'll be required to apply for funding and or generate a plan around how your county uses or will plan to use the funding. There are also icons to indicate whether sources are considered federal, state, or local funding streams. This detail in particular is helpful for you when you're prioritizing the funding sources that you are using or plan to use and looking to maximize the reach of each of those dollars, particularly when you're looking to maximize the reach of federal or state dollars before tapping into local funding resources. Now that you've seen a layout of this index, I bet you're wondering what is actually included in it. So this index includes over 60 funding sources spanning federal, state, and local funding streams. This list was developed through expert advice of our project's county and state advisors, as well as through the review of numerous counties' individual plans under the Stepping Up initiative, as well as a representative mix of individual county and program budgets. Funding sources identified in this index address the diverse needs of counties and people who are moving through the criminal justice system who have mental illnesses. And it also covers a vast mix of services that may be included within your diversion program, but can also help with the success of your diversion program. For example, the federal funding sources include Justice and Mental Health Collaboration Program and Second Chance Act grants, which are offered by the U.S. Department of Justice Bureau of Justice Assistance, which numerous California counties have successfully pursued in the past. It also includes federal block grants that respond to mental health and substance use needs, federal housing resources, and resources addressing other social determinants of health. The state funding sources include those specifically designated for targeted uses, such as for criminal justice and public safety needs, behavioral health needs, housing, and other social determinants of health, as well as state funding sources that may have more flexible uses and that can be leveraged across county systems. The local funding sources include common funding sources that are more universally available across counties, such as those regularly leveraged by specific county agencies. Now, we know that counties may have unique resources that they can consider when thinking through this funding category, such as local bond measures, taxes, philanthropic funding, et cetera. We did not capture those funding sources in this index, but they are definitely worth noting here as they are resources that I'm sure many of you are thinking about as you approach sustainability planning. We are in the process of thinking through how to best bring this index online because it is free for counties to use. So before we do have that ability to bring it online, you absolutely can access it. To do so, just send me an email at dadams@chsu.org, and I'm happy to send you a copy. And once we have something online, I think we're shooting for maybe a soft launch that covers some of our federal funding sources in mid to late 2020. So it is a ways away. So if you want access to it beforehand, just send me an email. I'll now walk through the tools that are designed to assist counties in identifying funding sources and prioritizing those funding sources to maximize the reach of those dollars. The first of these tools are a set of worksheets designed to assist with the planning process. The planning guides are worksheets that help you look at what policies, processes, and programs you currently have in place or would like to implement, areas where you may want to expand existing programs, and additional strategies that you may be considering in moving forward. These guides also assist you in doing a similar mapping exercise for your funding sources. I will illustrate only one of these resources because I think this one may be very practical and useful for you as you go through your sustainability planning. And this is the funding matrix to map funding sources. This matrix allows you to chart out funding sources that will pay for your prioritized strategies and is designed to assist you in identifying which funding sources to tap first. So ideally, those would be the funding sources that have the least flexible uses so that you can leave your more versatile funding sources or local resources to cover circumstances when no other funding sources are available. So this could be using the matrix to help identify how to best maximize funding streams with limited uses, such as federal, state, or other dollars that you want to use first to free up your local resources, and then reserving your local or more flexible funding pools to pay remaining balances or pay for programs that cannot otherwise be funded. Looking at the example illustrated here, which is based on a made-up county. So this is not any real diversion program, but this is a made-up county. But this example illustrates how a county could contemplate a range of priorities, such as processes requiring one-time investment, as well as a mix of treatment and services to benefit the participants of the diversion program. The plan also looked at the use of a diverse mix of federal, state, and local funds, all of which have varying degrees of flexibility. This matrix helps identify which funding sources are more restrictive and should be exhausted first, with the goal of leaving the more flexible funding sources to fill in gaps. The final tool in this series is the Integrated Funding Planning Workbook. This workbook is designed to complement funding and sustainability planning processes, again, in counties of all sizes and at various stages of the planning process. It is also designed to correspond with the other tools that I've highlighted here, but it can also be used on its own. Through its user-friendly interface, the workbook includes 4 sections to assist counties with their planning processes. The commonly used interventions tab highlights over 70 programs, processes, and policies used by counties across the country to respond to the needs of people who have mental illnesses who become involved in the criminal justice system. This repertoire includes a description of each intervention and links to external resources that can provide additional information. If you are in the process of identifying which components you want to incorporate into your diversion program, whether they're related to behavioral health treatment, criminal justice interventions, or internal cross-agency processes, I definitely recommend looking at this workbook because it's a really great resource for just seeing what's out there and what you could possibly do. The workbook also includes planning guides that complement the guides previously discussed and that are designed to correspond to what counties may already have in place when they look at sustainability and funding planning. And it also includes across-systems funding uses. I will come back to both the guides and the uses in a moment, but before I do, I want to highlight that the workbook also includes adjustable charts and graphs that can illustrate the total investment you are making to carry out your efforts, and it looks at investments per funding sources and investments across multiple fiscal years. The workbook was developed in Excel, which I know can generate a lot of reactions, but it is designed with a user-friendly interface. So regardless of your relationship with Excel, this workbook is easy to use, and it was designed with counties in mind. This workbook was also road tested with several counties to ensure that it is practical and that it can be infused into existing sustainability and funding planning processes. I'll now highlight a few of the guides in the workbook that may be helpful as you engage in your funding and sustainability planning. This guide illustrates how you can use the guide to determine the specific dollar investment that your county wants to make per prioritized strategy or intervention. And for each of those interventions, you can also identify all of the funding sources you will use to pay for it. You can also use it to specify how you plan to invest specific dollar amounts through each of those funding sources, and you can do this for up to 3 fiscal years. This guide also assists you in determining whether or not you will use funds on an ongoing basis, so carrying investments across multiple fiscal years, as well as identifying opportunities to allocate new investments. This guide can be used at any point during your planning process, whether you're just trying to see what the potential is for expanding your dollars, or if you have something in mind and you just want to put something on paper to double check what you are doing and what your investments look like. It is created to be user-friendly and to complement your existing planning information. So that it is designed that you can look at the interventions that you plan to fund and the funding sources that you plan to use, and it helps you to easily complete the guide once you get into it. Again, we were making this and designing this workbook so that it can be easily incorporated, anyone can use it, and it's not a taxing process on your existing process. This next guide is designed to automatically calculate the total dollar investment that your county plans to spend on each intervention and can calculate the investment across up to 3 fiscal years. This guide assists you in reviewing your total investment across multiple interventions, so across multiple policies, processes, and programs, and it allows you to review how investments may carry over across fiscal years and where new investments are being planned. This guide's user-friendly design takes information that you already entered into earlier, easy-to-use step-by-step guides to auto-calculate the overall investment of your collective efforts. For instance, if you use this integrated funding planning workbook to plan out the funding of all treatment services and other components of your diversion program, this guide will automatically show you how much you're investing for your entire diversion program, as well as how much you're investing for each of those components. This guide also allows you to easily make adjustments, as we know that sometimes the funding planning priorities change. So you can just simply go back to the easy-to-enter step-by-step guides, make adjustments, and see those adjustments reflected automatically here. We also know that it is helpful to look and track how you are spending funding per funding source, particularly as it ties into your overall agency budget or the overall county budget. So this next guide highlights just that. Similar to the previous one, this guide reviews your plan dollar investment per funding source, and it looks across up to 3 fiscal years. This guide's user-friendly design takes information that you entered previously to auto-calculate that collective investment. Just like the previous guide, it easily reflects adjustments if and when your funding priorities change. Borrowing the diversion program example again, if you use this integrated funding planning workbook to plan out funding for all treatment services and other components of your diversion program, this guide will automatically show you how much you are spending for your diversion program across all of your funding sources. The final guide that I want to highlight from the workbook corresponds to the question that we often hear from counties that are engaging in the collaborative cross-systems planning, which is, how do we know which funding sources are flexible or which funding sources can be leveraged across systems or across priority areas? This guide outlines the versatility of common funding sources used to pay for various operational and programmatic needs. It's not an exhaustive list of funding or their uses, but it is designed to help dispel some of the misconceptions around what can be funded through various funding streams, as well as helping counties engage in conversations around how to creatively use funding to pay for prioritized efforts and to potentially use those across county systems. I will highlight a few examples of how counties have used these tools, along with other examples of counties creatively engaging in sustainability planning in a moment. But before I move on, I do want to highlight that all of the tools covered today are free for you to use. Some are online, and I have the websites posted, but for any of these tools, if you want access to them, just send me an email, and I'm happy to pass them along to you. And for those of you who may be listening in without the PowerPoint, you can email me at badams@csg.org. So these tools were road tested with counties to ensure their usability and to also see how they can be incorporated in real-world planning processes. So one of the counties that we were able to road test the tools with was Calaveras County. Calaveras was selected because of its collaborative planning team, which spanned criminal justice and behavioral health systems, and which also regularly leverages the county's limited resources across systems to achieve the county's shared goals. The collaborative planning team also built and funded the county's jail-based screening process that led to Calaveras County becoming highlighted nationally as a stepping up innovator county, which was, of course, a bonus for us to have them road test the tool. Summary information about what Calaveras is doing under the screening process is highlighted on the slide if you want to learn more. The Calaveras road test helped to refine the tool to maximize their usability, as well as to demonstrate how the tools can be incorporated into existing planning processes. So Calaveras already had a team going that was looking at how they're currently funding their strategies, as well as how they plan to fund those strategies and maintain those strategies in coming fiscal years. So we were able to sit in on their road test to see how they are doing it, how well the tools fit, and there were some lessons learned that I want to share with you. The first is that, as you all very well may know, cross-systems collaboration is key to maximizing the reach of each dollar. The county illustrated ways in which criminal justice and behavioral health agencies could leverage resources to achieve their shared goals, including leveraging funding sources, sharing staff when they're able, and also the value of bouncing ideas off of each other to figure out the most efficient use of funding sources when those funding sources aren't very flexible. I had the opportunity to sit in on the road test, and for me it was fascinating to see, for example, how the county leaders were able to talk through strategies to share certain staff, and these were data analysis staff, to look at cross-systems data in order to better inform future funding allocations to pay for programs that benefit people who are going through the system who touch both criminal justice and behavioral health systems. The road test also highlighted how collaborative counties can address funding silos, such as by understanding what can and cannot be leveraged, as well as demystifying misconceptions around certain funding streams, especially in scenarios when federal and state funding dollars are being underutilized. I also want to highlight creative and innovative approaches that other counties are using to fund and sustain their local efforts. This first highlight is from a recent news story about Yolo County that I just love, that showcases how the county's criminal justice, behavioral health, and housing partners came together to secure funding to advance the county's mental health diversion and other criminal justice programs. The article emphasizes the creative approach the county took to form a criminal justice grant writing team, which comprised the county administrative office, district attorney's office, health and human services agency, probation department, public defender's office, and the county housing department, and how that team was able to pursue and successfully obtain a number of federal and state funding opportunities. I was also particularly drawn to a quote in the article by District Attorney Reisig, which basically said that by participating in the collaborative grant writing team, the county's collaborative partnership was strengthened even more. This article goes into more details about the activities of the grant writing team if you're interested in reading more about that, and I will say it's an absolutely fantastic read. I also want to highlight a few examples of creative funding strategies that counties have successfully pursued and that are captured in Appendix A of the Key Considerations Guide that I walked through earlier. Examples that are included in that The appendix covers Orange County's collaborative interagency planning process, which infused fiscal staff from the county's administrative office into every planning committee. The appendix also includes a spotlight on Yolo County's creative policy solutions to advance connections to affordable housing, Fresno County's approach to extending Mental Health Services Act dollars to pay for certain allowable jail services, Santa Clara County's process for setting metrics for county-funded services that are provided by contractors in order to ensure that funding is achieving specified county goals, and Calaveras County's process for inventorying the reach of funded services to better inform future funding priorities and decisions. I also want to share a number of resources that you can access to learn about new and open funding opportunities on the federal and state levels. The Council on Criminal Justice and Behavioral Health has a fantastic newsletter that regularly disseminates announcements of open state and federal funding opportunities, as well as other generally useful information. If you want to receive that newsletter, please email them at the email address on your screen. The Stepping Up newsletter also sends out announcements about open federal grant solicitations that can be used to fund behavioral health and criminal justice efforts, as does the CSU Justice Center's behavioral health newsletter. The CSU Justice Center website also hosts a webpage dedicated to announcing current funding and training opportunities, which include funding from federal sources as well as funding opportunities from national foundations. Grants.gov is also a very useful website that allows you to access open grant opportunities that are available through MIRA to federal agencies. So if you're looking to incorporate grants that cover other needs that fall, maybe outside of criminal justice or behavioral health, such as, housing or other social determinants of health and other needs, you can look here to see what federal grants are available. This website also includes useful grant resources. So there are tips on how to respond to federal grant solicitations, as well as tips for general grant writing. I also want to share general strategies that you can incorporate into your sustainability planning process. I know many of you may not be new to the sustainability planning process, but I want to hit home these strategies because they really are important. First, remember to start sustainability planning as early as possible. If you can, start planning from the very beginning of your program. This can help you look at the long-term goals of your program and ensure that your funding and sustainability planning efforts clearly correspond to the mission and vision of your diversion program. It is also helpful to identify early on the people who will be responsible for overseeing the sustainability of your program and those who will be great champions of it. Of course, there will be a number of partners and stakeholders who are involved in the planning and implementation of your program, but it's also helpful to look for partners who may be particularly helpful in publicly advocating for the continuation of your program. You may have a strategic ally that you can tap, for instance, to highlight your program at Board of Supervisor meetings or in other public arenas. It is also important to identify the cost of your diversion program. I know many of you have already done this in pursuing the DSH diversion funding, but it's helpful to regularly review the cost of your program as it gets off the ground. It's important to not only identify the direct, robust cost of your diversion program, but it's also helpful to identify the cost of wraparound programs that may not be included in those direct costs, but that can contribute to the success of your overall program. It is also helpful to identify the projected future costs of your program once that information is known. This can include identifying which of your current costs are one-time startup costs versus costs that are ongoing. And analyzing the funding needed to maintain your program is helpful in determining how you plan to pursue future funding opportunities, and to keep in mind if you have different goals for your program, such as if you're looking to scale up your program, any portion of your program, how you can plan for the sustainability of scaling up and the long-term longevity of that. Many of you have already also engaged in an asset mapping activity when pursuing the DSH diversion funds, but this too is something that's very helpful to revisit as you can regularly identify ongoing and new resources that you and your partners may have or that you can contribute. This may be something particularly useful to do as you think about your agency's or county's annual budget process, such as if there are changes in federal, state, or local policies that could impact your program or impact other services that benefit your program. A great example of that is the recent housing funding that has come down from the state. So whenever there are changes like that that can impact your program, it's really great to review this process. It is also helpful to identify potential new partners who can connect you to new resources, and these could be partners who can or may control funding that you need, like the Board of Supervisors, or partners who may have services or control services that can benefit your program participants. So one thing that came to mind for me here is how counties can partner with their Continuum of Care organizations. And for those of you who are newer to the housing conversation, Continuum of Care organizations they have access to a number of federal and state housing programs that may not come directly to the county agency if the Continuum of Care is not that county agency. So in some jurisdictions, the Continuums of Care are nonprofit agencies. And there could also be partners that you find who have an interest in the outcomes of your population and of your program itself. So these could be professional and community groups or private foundations, or even local hospitals. So for example, you may have a local hospital that could benefit from the long-term success of your diversion program if that can help to reduce the mental health-related emergency department admissions to their hospital. And we all appreciate the importance of data. With Darcy on the phone, I definitely want to hit home that. But it's also important to review how you are using data to tell your story. And also how you can use data to tell your story very creatively and compellingly. Oftentimes we look at data that we have on hand and figure out what story we can tell based on that data. But sometimes it's helpful to start out by thinking about the story you want to tell and then using that story to see what data you have to support it. That can also be a way to first come up with a compelling story that you want to tell based on what you see on the day-to-day basis of your program and finding the data to support that compelling story. It is also helpful to consider using both process and outcome findings to tell your story. Process findings illustrate how your diversion program is working, such as operational information around who is receiving services, when they receive those services, and the intensity of those services. Outcome findings, on the other hand, illustrates the impact of your diversion program on participants and paints the picture of how your program is creating positive criminal justice and health outcomes. Also remember that every data report you produce does tell a story about your program, and with any good story, it's helpful to have an engaging executive summary that highlights your findings and that can be used to easily share those findings with external partners and potential funding entities. It's also useful to make your performance outcomes information public so that it can be further circulated externally and to reach people who may be able to help fund or impact the success of your program. So, and with those public highlights, it never hurts to include anecdotal information about your program participants. Putting a human face on your diversion program is a great way to tell a compelling story that can impact the program and highlight the progress that you're making. It's also helpful to develop a marketing plan that you incorporate into your sustainability planning process. Marketing plans can help you figure out what funding opportunities to pursue, as well as help you determine what products you have or that you could develop to support your funding request. It's also helpful to have a set of talking points or an elevator pitch about your program. And you should customize these as well for each of your individual target audiences. So for instance, you can use talking points to create a shared messaging across all of your stakeholder groups so that when you're talking publicly about it, you all are consistently messaging the impact and illustrating the impact of your program. And you can also use talking points to help respond to grant proposals. So having something on hand before solicitation comes out can help with the process in writing that grant proposal. It's also important to think through opportunities to get your program highlighted publicly and in front of key stakeholders. So thinking about how you may be posting it on your website, or how you may be maximizing social media, or having your key stakeholders, so people who may have resources you want to leverage or control resources you need, having them take private tours of your program or attend an open house for one of your wraparound services. Coming to the end, but before I do, I want to highlight the importance of revisiting your sustainability program plan regularly and using it to identify what you have accomplished in sustaining your program and where you may want to go in the future. It's also important to review your marketing plan and your marketing materials, ensure that they are current and they respond to the emerging needs of your community and also the emerging priorities of funding sources, and to keep stakeholders up to date about the impact of your program, how it's successful, and how they can help contribute to the ongoing success of it by helping to support it or fund it. It's also helpful to think through funding requests that you may want to make to your key stakeholders. So if there are components of your diversion program that you definitely want or need to sustain, highlighting those. If there are particular portions of your program that are vital to its longevity, highlighting those for sustainability considerations, and also tapping your stakeholders to see if there are any new resources that they have access to or that they can connect you with that may benefit your diversion program. Now that we covered the importance of sustainability planning strategies and some of the tools that you can use as you think through that, I want to turn your attention to upcoming training opportunities around California's mental health diversion programs. The California Department of State Hospitals, the Council on Criminal Justice and Behavioral Health, and the Council of State Government Justice Center looks forward to hosting additional opportunities for California counties throughout the fall. These training topics include housing for mental health diversion programs, collaborative case planning, and a lot more. Please keep a lookout for the announcements. They will come from the DSH, and I believe they will also be posted to the DSH webpage. We also want to hear and learn from you about how your diversion program is going. We want to foster a peer learning experience for counties that are implementing diversion programs. So as you develop your program and have highlights to share, please contact us so we can hear about what's going on and help share the word across counties that are looking to borrow some of the strategies that you have mastered. With that, Darcy or Ashley, if you're on the line, I'll turn it to you to see if there are any questions.
Great. Thank you so much, Sienna. So much great information, super helpful. So just as a reminder to everyone, there is a chat function in the WebEx meeting window where you can send over any questions that you may have. Just direct them to me. In the meantime, we do have 3 questions that have come in so far. I might swap around the order because I think one of them might be an easier answer than others. So as we're going through these questions, please don't hesitate to send more in. So Deanna, the first question was, will you be willing to provide support on using the workbooks that you described in the webinar today?
I will say yes, with a caveat there, depending on what level of support you need. I'm happy to do a demo and a walkthrough with you virtually to walk through it. And if there are needs beyond that, we can talk more to see what your needs are and my capacity to do that. But absolutely.
Awesome. Thank you. I think that that would be super helpful, and maybe we should get that on the books too. So some of the questions that might be a little bit more in-depth. The first, can you suggest some best practices for funding housing?
I will speak generally. If there are specific components about funding housing that you're interested in, please add a different question. So one, I will start off with when you're looking at a mix of the state and federal funding sources, it's really important to see how, what the target population is for those funding sources and how that aligns with your population. So the reason why I bring this up is for federal resources, for instance, they have a specific definition of what it means to be what they call literally homeless, and a lot of the funding sources are for that population. Unfortunately, if you are arrested and in jail for a certain period of time, you lose that classification. So you are no longer able to have that person connected to federal resources because they no longer qualify as being homeless once they're released from jail. So that's one strategy. With just looking more broadly, we definitely recommend using some type of assessment to gauge the housing needs of the people who you're working with. There are some out there that some of you may have heard of, such as the DSH. Do not ask me what the acronym stands for. I can email the acronym to you if you're curious. But there are also other housing assessments that are out there and are free to use that can help you identify the level of housing needs, the type of services that may be helpful to maintain that, the housing for that person, and where to prioritize your resources. So that's a little, if I did not hit on, the specific questions, I know housing is a very important concept. Please let me know. We also have, and we're planning, I believe, for early October, a webinar that is solely focused on housing. So please keep a lookout for that. If you have questions in the meantime, I can also connect you with two of my colleagues who are housing experts in this area who can, better assist you. And then I also believe next Wednesday, the Council on Criminal Justice and Behavioral Health is hosting a forum around housing in Sacramento. So if you happen to be in the area, that may be a great opportunity for you to join.
Great. Awesome. And for if there are any other housing-related questions, please feel free to send them over in the chat function as well. Okay, third question for you, Deanna. Do you have suggestions for streamlining the process of grant, I think it means grant writing and the follow-up reporting that are required for funding? So I guess the question is maybe asking just kind of streamlining, and especially when you're using multiple sources, that there could be a lot of requirements for reporting out, as well as the initial requesting that's going in. So I guess just maybe overall suggestions for streamlining that process.
As I work more and more with California counties, I love being able to see the vast amount of funding sources they're tapping in. I actually have coworkers who provide technical assistance to the recipients of a few federal grants, including the Justice Mental Health and Collaboration Program and Second Chance Act Program. I will say, if you're asking about those, if you receive one of those grants and you're asking about how, that fits in with other funding you receive, I will just first, put the note out there, talk to your technical assistance provider. But a lot of it is helpful to see how, and part of it, I think, may go back to the concept I mentioned as far as the matrix, as far as seeing how those funding sources, what they fund. So what are the specifics within your grant award to see where they fund, and doing a chart out of how you can fund different priorities to effectively use those and to span those. With regards to with the reporting process and figuring that out, depending on the awarding entity, there may be very hard and fast deadlines that you need to consider. So there's for some of those, there is some flexibility if you do have a lot that are due around the same time to stretch those out. But there's not an easy way to necessarily figure that out, but that is a consideration you can take as you are pursuing it, seeing what staff you have on hand to help respond to those and to complete those, how you can stagger it among available staff time, and then just because I really love project managing, it may be worth looking into free, or if you have existing subscription project managing software to help answer those and respond to those. I know that looking at those may be a bit complex, and I know Darcy was trying to tease out the question. So if you do have more specifics on that, I did not address, some of what you're looking for, please, write in another question. I can respond. But before I turn it over to Darcy for another question, on the National Reentry Resource Center website, the NRRC, there are a number of resources available there that help, whether they're webinars or written materials that can help respond to how to manage a variety of grants, whether they're federal grants or other grants with other funding opportunities that you may have. So you can visit that website. I do not know the website offhand, but if you Google the National Reentry Resource Center, you can definitely find it.
Perfect. Thank you so much. Are there any other questions? I'll maybe leave it open for another 30 seconds for people to send any questions in. Otherwise, we will give everyone 9 minutes back. So seeing no questions coming in, we want to thank everyone for their participation in the webinar today. And again, a big thank you to Deanna and CSG for their support of DSH Diversion. This recording will be posted on our website within a few weeks, and the slides can be made available. If you have any other questions, please don't hesitate to reach out to DSH Diversion at dsh.ca.gov. Thank you so much.